Senate Republicans were racing against the clock tonight. They were trying to come up with a new Obamacare repeal and replace plan before the 4th of July holiday weekend. Chief Congressional Correspondent Mike Emanuel live back on the Hill tonight to tell us where we are now. Good evening, Mike.
Bill, good evening. Senate Republicans left town without striking a health care deal. Some suggest at this stage there was no point in waiting around.
I'm having 2 town halls tomorrow, so let me ask you. Is it more important to cool my heels in my office, waiting for these conversations to take place, or speak with constituents?
It's been a very tense week in the Senate. Fox News has confirmed that Majority Leader Mitch McConnell and Ohio Senator Rob Portman had a testy argument over Medicaid. That's striking because they're typically close allies, and any calculation to get to 50 votes on this issue would have to include Portman.
Senators and the White House are continuing discussions on the path forward on bringing relief from Obamacare and its collapsing markets. We've made good progress and we'll keep working.
$45 billion has been added to the bill to address the opioid addiction problem, which could be designed to win over moderates, but Portman remains non-committal.
We've had differences of opinion in our conference, yeah, but I wouldn't call them arguments. I would say we've had an honest debate about different approaches, and my focus has been on ensuring that low-income Ohioans continue to receive care.
Senate GOP sources say the most likely no votes on health care reform are Susan Collins, Dean Heller, and Rand Paul. The problem for leadership is they can only afford 2 Republican no's and pass a bill.
I still sense that we're at impasse, and I said that yesterday at lunch with our Republican caucus, and everybody kind of laughed because, yeah, there's still quite a bit of disagreement. And there's basically 2 factions.
There's been some suggestion Democrats are also split. There are the moderates like Joe Manchin of West Virginia and Heidi Heitkamp of North Dakota who say they're willing to discuss improvements to Obamacare, while more liberal members like Elizabeth Warren from Massachusetts and Bernie Sanders from Vermont are calling for universal health care.
I think the caucus would love to work to get health care for better health care system, fix what's wrong with the current health care system.
Some of my colleagues on the other side are claiming they want lower premiums. But if those lower premiums come with higher deductibles and higher copays, nobody benefits. It's a bait and switch.
A key conservative says doomsday predictions aren't fair.
The majority of all Americans get their health insurance from their employer or their spouse or parent's employer. Our bill doesn't touch that at all. So that's a majority of Americans right there.
Now the test will be whether giving it time over the 4th of July break will only make matters worse. Bill?
Mike, thanks. Mike Emanuel from Capitol Hill tonight.